Hello and welcome everyone to the Modio U for our OneView 102 course, Intermediate Features and Developing Workflows. Today we're going to cover a few topics and I'm going to go over those right now. So in today's training, those topics that we're going to cover will be our onboarding feature. Then we're going to move into navigation tips and tricks. We'll do a deep dive into payers. We'll go over some reporting basics. We'll cover the notes section as well as logins, and we'll finish up with some facility management. So before we go any further, we will go ahead and take a look right here at the platform itself. Today, I'm going to be using one of our demo teams. So of course, it's going to look a little different when each of you are in your own team. Don't forget, if you have any questions, to make sure you're reaching out to support@modiohelp.com. You can always use our support tab up here, or if you're on during our out business hours, we do have live support through the chat feature. So starting off, as promised, we're going to discuss the onboarding feature within the platform. So onboarding is a way to send an invitation to your provider, giving them access to the platform. It's really a cool feature because you're able to both customize the invitation as well as the pieces of the platform that you want them to fill out. A lot of organizations are able to kind of replace new provider intake forms this way. So to start this process, first we're going to take a look at how to customize the message and send that invitation. And there's two ways to customize that message. You can either click right here at the top where it says message, or right here on this page here in V1 where it says send new invitation. If you are over in V2, you can also start this by right clicking in here and say message providers. Either way will get you the same outcome. I'm going to click right here where it says message, and that's going to take us to this same dialog box. Once the message box pops open, this is where you're going to be able to both edit your message and send those invitations. So the first step, of course, is wanting to edit the message so it's in there and ready to go. You can see, since this is our demo team, we already have a message in here. But if I needed to make any changes to that message, I'm going to click right here on this little editor box. It's the little paper and pencil looking icon. That's going to open up this dialog box where I can make edits and changes. So here I can put in my subject, and I can also put in my message. You can type freely in this box. You can also copy and paste any message that you would like in here. A lot of organizations use this as a way to send a welcome to your new providers, list out any kind of instructions that you want to give them, letting them know about the platform, why you're having them fill it out, etc. Once you hit save, you're going to change and save whatever message you have put in here. I'm going to hit cancel for today because I don't want to make any changes to our message. Okay. So once you're happy again with that message, you'll hit save, and it will be there every time you go to open that message, just like you saw our message was in here. Once you have your message and you're ready to send new messages to your providers, you have a couple options to do that. You can search by your provider's names, typing in first or last if you would like to. You can come down here and use this little scroll bar here. If you see the provider's name in red, it means their email is not a valid email and you need to address that. But if it's a good email, it'll be in black, and I can click on that email and it'll put it up there in the system. If you would like to send multiple email invitations at one time, you can certainly do that. All I have to do is click on the additional emails that are valid, and it will put those up there into the system. If I have sent those previous invitations before, then you'll notice that I can't click on those additional invites. So it won't let me send those additional invites when they've been sent before. You can also use tags as a way to send additional invites. I'm going to go ahead and clear all of those out. If I wanted to send an invite to just one provider, I also have the option to email a copy of that invitation to myself. You'll notice that box up here if that's something that you need to do. We do have robust tracking though, and we do have robust spreadsheets that include ways to monitor and keep up with all of the sends that happen so that you'll have a great way to stay on top of all of these sends that you're going to do. And we'll go over that here in just a minute. So totally up to you what you would like to do, but we do have multiple options. And I just want to go over all of those. So you'll also notice that there's an option right here where it says choose file. So I can choose to attach a file on this invitation. We usually recommend only attaching a file that is read only. So a good use case for that would be if you've got like a welcome packet, maybe you want to include a map of your location, some kind of a handbook that's there for your providers, etc. I also highly recommend attaching, we have a great tip guide that's aimed directly for users to use related to the onboarding system itself. And I'll show you that here in just a minute. So I'm going to go ahead and hit cancel out of here. And I'm going to pop out here to the support page. So when I click out here on support, we're going to come down. At the top under coordinators, there is the tip guide for provider onboarding. This is the one that's aimed at all the coordinators. If you come down a little bit further, you're going to see that there is a tip guide that says Provider's Guide to Onboarding. Now, this tip guide in particular, this is the one that I highly recommend that everybody download and include as a copy on that invitation to your providers. This is a great way to help them stay on track with getting signed in and claiming their profile. It's got a quick little demo of what that invitation is going to look like to them, reminds them of how to claim their profile, which is super easy. They just need to leave that email in place. All they have to do is create a password, agree to terms and conditions, and it's going to take them right out there to the onboarding platform, which we're going to take a look at next. It also walks them through it every step of the way. And one of my favorite things about this tip guide is it also walks them through how to log back in, how to use the platform again once they are logged back in, and also what they need to do if they have any further questions. You'll also notice on this page, nowhere here does it say contact any of you guys as coordinators for their help and assistance. It does direct them back to us so we can help them get logged back in or help them troubleshoot any issues that they're having. So 10 out of 10 recommend attaching this to all of their invites. All right, so moving on, let's talk about what you're going to do after you've sent out all your invites, because you're going to want to have a way to keep track of your providers and their status and what they're doing within the platform. And what you're going to do is come back over here on to the platform and take a look at some of the reporting options. So these envelopes, as you send out your invitations, they're going to be able to change their symbolism here. You can kind of see that on my page as I scroll through. They've kind of changed the different pictures, graphs here have changed. And I can hover over this question mark and it'll tell me what's going on with those providers' profiles by looking at those picture graphs. And those are great, but most of you guys don't have time to kind of scroll through and look at those pictures and determine what's going on based on that. So we have some better reports for you. And if you click down on the reports drop down, you can see that there are some reports we can choose from. The first one I like to look at here is the completed items report. So this is a great report. It's a web report. It's super useful because it's got this section right here for onboarding. And you'll notice that there is an option right here where it says new invitation, sent invitation, accepted, incomplete, completed by the provider, or completed by the coordinator. When we take a look here at how to edit the profiles, I'll show you exactly how we would end up with a profile that was completed by a coordinator. So just so you know, you have the ways to filter and take a look at, who's completed their profile as a provider, who completed their profile as a coordinator, who's still got an incomplete profile, etc. And what I really like about this web report is that I can really take a look at my team as a glance. I can search through and find particular providers. I can also come over here and look at what kind of forms they have completed, look at what kind of logins are handled, what kind of forms are done, etc. Another report option that also gives me data related to onboarding is going to be my providers report. And this is a CSV report, which means that I can manipulate the data. And I'm going to get this pulled over to my screen here. And there's a couple columns related right here to onboarding as well. So I really like this one. It can be so handy to throw a filter on these columns right here, especially like this one. I'll throw a filter on it, and then I could narrow it down to maybe everybody that's got that incomplete profile. And then, for instance, I'll grab all the emails here that are the work emails, put that on a BCC, email out, and just remind everybody, hey, I really need you to complete your profile so we can get those missing items handled. It's a great way to keep on track of those onboarding profiles. So without any further ado, let's go ahead and take a look at how we're going to edit, change, and ask our providers to fill out their own profile and help us get the best use out of the platform. So to make edits and changes to the provider's to make edits and changes to the onboarding profile itself, we only have to go into one of the provider's profiles, and it's going to hold for the whole team. Just like the message holds for the whole team, the onboarding profile will hold for the whole team too. So I'm going to pick my first provider here on the list. I'm just going to click on that provider's name. All I have to do is come down here to summary, and I'm going to click on the top right-hand side on the little editor button. Again, all of these steps are in the tip guide that I mentioned before out on the support page. So if you need any step-by-step instructions, you're going to find those there. Okay. When I stop right here, this is the view that the providers are going to have when they log in, when they've gotten my invitation. Okay. So these are the pieces that they're going to see. Right now, ours is a little bit customized already. Anything that is in red is by default the areas that they are going to have to fill out. If I want to make changes, what I'm going to do is click right here where it says onboarding editor. Now, this is an area that only the coordinators have access to make those edits and changes. And again, this is really nice because you only have to do this one time or as those profiles need updated. So I can come in here and make as many edits and changes as I need to. Now, some areas of the profile are required in order to make it function. Things like a first and last name. We have to have that in order to make a profile. You know this because when you enter a new provider's name or make a new provider profile, you have to put a first and last name in. You're not going to be able to get rid of that field. However, you can do things like make them read only. And I know some organizations that like to do that. So they, if you've got Michaels, they can't turn themselves into Mike or anything like that. Okay. So you have options. You can also just come over to other fields like mobile phone and make that a required field if you would like. And then it will have an asterisk next to it. So when the provider is filling out the form for their onboarding, they can't mark it as completed until they've given you a mobile phone number. Okay. So you're going to come through each of these sections and fill them out as whatever you would like them to fill out. If there's a section that you don't find useful, you can actually disable that entire section. So if you are a group that doesn't use hospital affiliations, you could disable that entire section. What will happen is down here at the bottom, hospital affiliations would be shown with that eye with the line through it. What will happen is when we come back and look at that provider's profile, you're going to see that no longer does it show us asking that provider for any information related to their hospital affiliation. But if we take a look and come back at the team, and really it wouldn't matter what provider we go into, but you'll notice that facility affiliations is still part of their profile. We're not doing anything to the actual platform itself. We're just changing what information we're asking that provider to fill out as part of that onboarding process. So I'm going to go ahead and restore this as part of ours, but you can see you have full functionality to make any edits or changes. You know your providers best, so you can make these as complicated or slim as you need it to be, and you can get the providers to fill out as much information as you need it. This is a great example. We've got the peer reference section, and what I did is I clicked right here on this little blue line, where I clicked the edit, and you can change this number of peer references. So for example, we put in 3, and then in the description box, you can put in what kind of peer references you want those to be. So you can put in, that one of them has to be like the medical director or coworker or client, whatever you want those peer references to be. You can also put in information about what you don't want those peer references to be. You'll notice here on this line with the work history that there's a description here about what you want for the last 10 years in work history. And what those look like when we come back over here and look from the provider view is if I hover over that question mark, you can see that information. And when we open up in peer references, there's a big flag here to let them know what kind of information needs to be there for peer references. So again, you can help enable your providers to success by giving them information in each of those sections. Again, it's nice because you only need to make these edits and changes one time and it'll hold for the whole team. When we come down here to the login sections, typically by default, this section is disabled, and I'll go ahead and just show you what that looks like. And then we can take a look. So by default, it usually looks a little bit like this, and I will go ahead and show you what it looks like here. Apologize, one moment. All right, so logins would look normally like this, and we'll go ahead and enable that section. And then you just enable the search function that you are looking for. It's pretty easy. And then all you have to do is you can either add or remove any login that you're looking for by clicking in this box. So if you want to, there's a lot of websites to choose from. These are some common ones that we use. So like DEA, FSMB, NPES, CAQH, etc. So when you have those in there, I'll show you from the provider side what it looks like. Logins by default are a required field, but it's going to give the provider a spot to put in their username and password. And then in a little bit here, we're going to flip over and look at what that login dashboard looks like. But it's going to give you a chance to manage those logins for your providers. I'm also going to enable the document section, and then we'll go ahead and enable our search. You can also search and add additional document types if you would like to. So we can just look for a new document if we need to. So if we need to look for maybe their birth certificate, or we need to find a cleared one for check, a bank letter, avoided check, we can, there's a variety of document types that you can add on to your request there. So when we come back, come down here and take a look. And you can see this is what it looks like when we request those logins from providers. So you've got these areas where the provider can just fill in their login information. The system's also smart. If you're looking at a provider who has been working in their onboarding profile and some of the information is filled out, you won't see, for example, like a login as showing as missing anymore. Those logins will just drop off here, so they won't show as required. Documents as well, this list will get shorter for you as those documents show up in the system, but it makes it really simple because all the provider has to do is click here to browse, or they can drag and drop those documents in. So it couldn't be easier for the provider to upload or drag and drop those documents in. I know for a lot of providers, they really like having this interface because they feel more secure about uploading their sensitive documents and information directly into their profile rather than having to email that or sending it through other means. If you, as a coordinator, like to work out of this side of the platform, you can also work out of here. You can add additional information. All you have to do is hit save as next. We can come into another provider that doesn't have a profile that is complete here. So for example, this provider will come in here. And when I'm in this provider's profile, you can see that once everything is done, you do have the option to submit as complete. If I were working this provider's profile and I completed it for them, I could submit that as completed, and this provider's profile would end up being marked as completed by a coordinator. Okay. All right, I'm going to move back up here to our team. So far we've covered the message, how to edit it, how to track all of the invitations that have been sent, as well as how to edit and maintain our profile. The next things we're going to take a look at is that login dashboard. So I'm going to come over here to the login dashboard. This is where all those usernames and passwords are going to come out to. And it's a really nice feature because those usernames and passwords will automatically feed out here for you that you've collected in those in that feature so that you can have access to those. The other thing I really like about it is that as coordinators, we can add our own logins out here as well. So if you are assigned as a coordinator out here, so like myself, if I found a website that I needed and I had a login for it, I can put in my username and my password. I can add any notes to it, and then all I need to do is save it, and I can put that information out here. I can also use this dashboard as a great way to search and narrow down things for me. So if I'm looking for just my own passwords, I can search for myself. If I am working on a certain kind of password, certain kind of work that I'm doing that day, so maybe I'm working on my CAQH that day, I can narrow my work down and just see my CAQH. Okay. One thing to keep in mind, you do want to store only credentialing information and anything that you are comfortable with all the coordinators on the account being able to see. When you open the passwords and login information out here, anybody that's a full access coordinator is going to be able to access that information. This is really great for eliminating any single points of failure, but that also means that anybody can access it. So you don't want to put anything that's of a personal nature out here. I also really like it because it does contain a link to the website so you can log in. Then when you come back, you just click on the eyeball to reveal the information. So then you can just copy and paste the username and password. And then if there's any kind of notes or information reminding you about when to renew, what those password hints are, etc., you'll be able to find it there below in the notes as well. Okay, so I will go ahead and close those out. Moving on, we're going to take a look here at the notes dashboard. It also functions very much the same way. You can search by your provider's name. You can do a note type dropdown, and you can use multiples of these, of course, as well. So I can search by a particular provider. I can then narrow it down to a certain note type that I'm looking for. I can hover over the notes here, find the note that I'm looking for, and then I can even edit and add additional notes. So quite simple. You can do that, and that information will be stored right there. So this is just a great way to review if any of the notes that you add throughout the platform. You can see it's quite easy to end up with a lot of them, and this dashboard is a great way to search through those. So I'm going to pop back out here to the team button here, and I am going to hop into one of our providers here, and we will take a look a little bit deeper into the platform. So one of the things you may have noticed by now is that there are some little check marks here in the different boxes, and some providers have more of these check marks and some providers have less. Well, these check marks are assigned by the system when it views the information that's in there and decides that it has enough information. Now, you can assign check marks to the boxes. It is just system assigned, but there is a bit of a workaround that some folks like to do, and we just like to let people know about it. If you right click in one of the boxes, you can make those boxes appear this bright white color. So some folks like to use that as a way to audit and use that as a way to communicate that those sections or fields are completed. Okay. The next thing I would like to talk about is actually pertaining to the fields that have the copy button. So for example, practice employer and facility affiliations, as well as healthcare payers. Those are great, but areas that often need a lot of time and effort to build them up. And they also often have, if you have a lot of providers that are at multiple locations, but sometimes you have ones that share those locations, you can use a copy feature to share and move information from one provider to the other. So for example, if I needed to make sure that Dr. Bell had all of her locations correct, I can click here on this copy button and use one of my other providers, or for example, I have an FAC profile here that I can copy from to make sure that all of the locations are up to date. If there's one that was missed, then I could go ahead and move that one over as well. So you can add or remove any ones that you wanted, etc. Pretty straightforward. You can search from the different providers. You can take a look through that. So those buttons work the same in both sections. Pretty straightforward there. And then once you hit copy, that information will copy over. What does not copy over, though, is anything that's provider specific. So, for example, anything that's related to this credentialing information, things like an initial credential date, a last credential date, an end date, or those reappointment start dates. Now, keep in mind, everybody, a reappointment start date, just as a reminder, is always in there for you and your organization to put in as a reminder of when you want to restart the credentialing process for that location, for that provider. So whatever you need, if their end date, if you need 90 days to re-credential them, then you would put that 90 days before the end date for that location. Same thing in the facility affiliations. You're going to find boxes for that as well. I apologize, I clicked on one that says canceled. Here we go. Reappointment start date. There we go. You're going to want to put that at 60, 30, 90 days before that end date. You want to make sure that all of your locations are in order before we go down here, and let's talk about healthcare payers. I know payers are often a big part of many people's workflows, and you also have a copy button here in the payers section, okay? That can be really helpful because you can build up either if you have providers that share the same locations and the same payers, you can use one provider to build up their profile, copy their locations over, and then also build up their payers and then copy their payers over. You want to do it in that order because when you go to copy from one provider to another, you want to make sure that they also share similar locations. So for example, when I click from another provider and I have the new, it's going to compare what payers are in common, what payers, so that's going to update those existing payers. It's going to add any new payers, and we can also update and make sure that we have the locations that are in common put in as well. This will save you time and effort in the long run. So if all the locations are the same, that's going to save you time by adding those locations that you see right here for those payers automatically. Because when you go to add a payer, you want to make sure that you're also assigning the correct location that that payer is valid for, okay? When you have payer information in for a provider, you can store information at what we call either the payer level. So we have information right here for this one. You can see we have, this is an Aetna payer. It's through the state of Arizona. You can see the application was submitted. We have some information right here. But if I click on one of the locations, you can also see we have a provider ID. This is what we call information at the facility level, okay? And we can go to the different facility levels and see the information that is entered at those facility levels. You can also see that facility level data listed here with the different provider IDs in the line items. That's how you read it across here, okay? So you can store information for each facility with that payer in one section. So you don't need to make multiple entries. You can have just one entry with all of your locations for that single payer and store the different data all together in one, okay? Same thing with this one, with the Cigna. You can store the different contracting dates, if there are any, for the different locations, etc. Okay. So we have our payer information. You now know how to use the copy button. You now know how to store information at both the payer level as well as the deeper level of the facility levels. And we have taken a look here at how to successfully add and make sure that we have facilities on all of them. You are going to want to make sure that you have facility locations on those records too, especially later when you start using tracking. The last thing I want to touch on is, speaking of facilities, is for maintenance purposes for your account and keeping everything up to date. So if we click right here on your reports dropdown, there's a facility master update list. And this is a report that you're going to want to run fairly regularly. It's a pretty important report, but it's also a really neat report because it's going to show every single one of your locations as a unique uh, location. That is, it doesn't show your any repeats of your facilities or every provider at each facility. If you needed to see where every provider is at with each facility, you're going to want this facility report. What this one does is show each facility as a unique facility. And you want to run this on a fairly regular basis just to make sure everything is current and up to date. If you have any new information related to a facility's, tax ID number, phone number, address, anything that's changed, a name, if they have a DBA name, their CLIA, hours of operation, anything that's here on this form, if you need something just updated, all you have to do is change that information, highlight it in yellow, save it as an Excel sheet, and then send that over to support. We'll get that automatically updated in our system. What's really nice about doing it that way is that whatever information has been updated will automatically be updated on the back end to that provider's profile in your profiles, and you won't have to do anything to update it. So for example, with this provider, if we had a phone number that needed to get added, it would automatically be updated right here, along with every other instance where that where that facility was loaded. So it saves you a lot of time and effort, and you don't have to worry about updating all of those instances. So I know that was a lot of information to cover, and I just want to go out here to support and make sure that here are the main tip guides that I was using today, the copy feature one, as well as the provider onboarding one today, and also the facility management one. Those are going to be super important for you going forward. I hope everybody learned something, and I hope you had a great day. Thanks for joining. Take care.